What is lower extremity angioplasty, with or without stenting? Lower extremity angioplasty is a procedure of opening a blockage in the arteries of the lower extremities, or legs. These arteries include the aorta, the iliac, the femoral, the popliteal, the tibial, and the pedal. It is done to improve blood flow in the feet and legs. Blockages made of fatty cholesterol and fibrous plaque can cause a decrease in blood flow and lead to pain in the legs with walking. If the blood flow reduction gets severe, it can cause pain in the foot or leg while resting, wounds that are slow to heal, or loss of foot or leg tissue, also called gangrene. In this procedure, a very small tube called a catheter is inserted through a small, less than 5 mm incision in your groin or arm. Through this catheter, a small amount of dye is injected to identify if you have any blockages. Once a blockage is identified, another small catheter with a tiny balloon at its tip is placed across the blockage and then inflated, pushing the blockage away into the artery walls. Depending on the location of the blockage, stenting may or may not be done. What happens before the procedure? You are not supposed to eat anything after midnight on the day of the procedure. You should take your morning medications with only a little water on the day of the procedure, unless specifically requested by your doctor not to do so. If you have any diabetes and use insulin, you may need to decrease the dose of insulin in the morning of the procedure. If you have an allergy to the dye used for the procedure, your doctor might prescribe some medications to be taken a few days before and after the procedure. If you have any kidney problems, you should take plenty of water for 24 to 48 hours prior to the procedure. On the day of the procedure, you will register yourself at the admissions office. Following this, you will be directed to the catheterization laboratory, where you will be placed in recovery area and meet your nurses and physicians. They will perform a brief assessment and examination and go over the risks, benefits, and alternatives of the procedure with you. Then you have to sign a consent form. You will then be escorted to the catheterization laboratory. A small amount of numbing medication is injected into the skin. In the majority of patients, this is the only part of the procedure that is slightly uncomfortable. A tiny incision, smaller than 5 mm, will be made in the groin or arm, and a small tube, less than 3 mm, is placed into the artery. A small catheter over a soft wire is sent through the tube and is guided through the blood vessels to the arteries of the affected leg. The doctor will then take pictures of these arteries using a contrast dye and X-ray. Once a blockage is identified, another very fine metal wire is used to cross the blockage. Over this wire, a small catheter with a balloon at its tip is advanced and placed across the blockage. This balloon is then inflated and pushes the plaque into the walls of the artery and increases the arterial lumen, or inside the space. This lets blood flow through easier. If your doctor decides to put a stent, he will do it at the same time. The stent is the only thing that stays in your body. Everything else, including all wires, balloons, and catheters, are then removed. The small tube first placed in your groin or arm is either removed at the same time or secured to the skin to be removed later that day. What happens after the procedure? You will be observed for 6 to 24 hours for any complications. You should be able to walk within a few hours after the removal of the tubes from the groin or arm. The average hospital stay is 1 day or less. Some patients stay overnight for observation, but many go home the same day of the procedure. You may be put on blood-thinning medications after the procedure. It is very important to use these regularly as instructed. Otherwise, a blood clot may form at the site of the recently opened blockage. Avoid any strenuous activity with the leg or arm where the tube was inserted for 2 to 3 days. If you notice any bleeding, call the nurse or doctor immediately.